So I suffered from depression, anxiety from I was around 12, 13 years old, and I was first prescribed medication around 13. And then around, I think it was 18, I got diagnosed with PTSD and then diagnosed with a separate uh, account or diagnosis of PTSD whenever I was 23. And it was in that year that I got the TMS treatment. Had from a young age, I had done CBT a number of times. Early on, they thought it was anger issues, so I done anger management. I was seeing a psychiatrist and a psychotherapist. I was on numerous antidepressants that were talked about before there. Uh, I was on anti-anxiety medication, and then I was put on some kind of I don't know the ins and outs, but it was just a medication to put me to sleep to try and just blanket over all the symptoms and problems that I was having. And then I was admitted into a psychiatric ward last year and self medicating with cannabis and years ago with alcohol and painkillers as Lyrica and Tramadol. But I'd stopped taking Lyrica and Tramadol and alcohol. So I'm coming up to 6 years sober from that. But I was still using cannabis and CBD oil up until receiving my treatment. It was my mother. She was trying to find any alternative way forward, as it was showing that medication and talking based therapy, as well as I was doing EMDR therapy as well with my psychiatrist, and it just wasn't. It was making very very small differences, but over long periods of time, it wasn't actually taking a hold of my life. So she found it, as my psychiatrist he was leaning down the road of the ECT convulsion therapy. And my mum had previous experience with a friend years ago that she had seen receive this therapy. So she was quite against it. And she just went searching the internet for kind of any answers and ways forward to go. And she found TMS and started researching that. And whenever she came to me about it, she had already done so much research on it to kind of work out this could work, this could be a chance. And then it was just up to me to kind of accept that I was worth kind of one more shot. At that stage, I was so low. I was telling my parents, my life is not worth any money. So it took a while for me to kind of accept that and move forward to do the treatment. People that I've talked to, whenever you're telling them about the treatment, they kind of instantly think that it's going to be some crazy, machine, but it literally just does feel like a tapping, um, just above your hairline, and the, it's nothing. Do you know? I'm covered in tattoos, and if I could compare it to that, it's like not even 1% of a tattoo. It literally just feels like just getting a slight tap in your head, and just like a tingle. And yeah, it's compared to like medications and stuff. It's a walk in the park. Yeah, one of the first things I noticed, and it's such a weird experience, was I was in a room, and normally I would sit at the back of the room, make sure I have my back against the wall, and I would literally just look down at the floor. And this time I was looking up, and I was kind of just like looking at the ceiling, and that kind of experience of there's a ceiling in this room. And it was just weird because for so long I had not experienced something as simple as noticing the upper half of a room. And that was the first kind of little light bulb that was saying to myself, something is changing. And at that point I didn't exactly know what it was, but there was a difference and a change in my own mind's behavior. And I remember going the next day to treatment and talking to Ailish and saying, I want more of that. What can I do? I want to experience more of that. Like, so from then we started setting goals to kind of chase that feeling. One of the things that Ailish was really trying to help me with was alongside relieving symptoms of the depression, anxiety, and PTSD. It would be very easy to still sit in my bedroom and tell myself I'm not feeling depressed, but you, after having it for so long, you don't know what a healthy person is supposed to do. You don't know how to live. So Ailish was giving me these small goals to try and build myself up again. So things like she would say, right, tonight I want you to try and walk down to the shop. Do you know, if that's too much, just try and leave the house, walk down to the bottom of the street and go back home. And so alongside the treatment, I was also starting to rehabilitate my habits. And that was a massive step forward for me because all of a sudden it didn't feel like I was up against the world. I was actually able to do these things again. I haven't had, do you know, any relapse. Do you know, I've had what I call the natural human emotions. You know, I felt sad if I've watched a sad movie, or if I've got something coming up, I get a bit anxious. But one thing that I've always wanted to do is to be able to manage, just like a healthy person is, to manage your own mental health. So taking on certain habits and healthy habits, you know, exercise, eating healthier, talking with people and not letting it build up. Whenever I got the treatment, I that's whenever I put these things in place just after treatment, so I could really take responsibility of my own mental health and manage it. And if I do have a slip up, you know, the first thing I do is tell, you know, my parents, you know, I'm feeling a bit down, and most of the time talking through it and just cutting it off at the start is really enough to kind of set it off motion.